Heart attack, stroke, and type 2 diabetes are all serious health problems currently today in the United States. According to the Centers for Disease Control, most of these current conditions are preventable. Preventing disease is easier than treating a disorder and more cost effective. Without our health, we are unable to live our life as God would intended. As a Christian nurse for 11 years and someone with weight issues, I understand the issue of preventative health care. There's a current healthcare crisis in the United States today. If individuals would take responsibility for their health by making healthful decisions and modifying their high risk factors, we could have a better quality of life. The next few minutes I will be talking about common chronic disorders that have led to the healthcare crisis in the United States, and also about the cost of these disorders, and how Americans can take steps to take responsibility for their own health. We will now look at this in the healthcare crisis. According to the Center for Disease Control, chronic diseases such as heart disease, stroke, and diabetes are at epidemic levels in the United States. These are all potentially preventable and very costly. According to Brian W. Ward, PhD, Janine S. Miller, MPH, and Richard A. Goodman, MD and MPH, 1 in 4 adults have 2 or more chronic diseases. Here's some more sobering statistics according to the Centers for Disease Control. In 2006, 84% of healthcare went towards chronic disorders that were potentially preventable. Also in 2006, $223.5 billion went to patients that drink too much alcohol. In 2010, heart disease and stroke cost Americans $315 billion. And in 2012, the cost of diabetes was $245 billion. My second point is about the cause of these chronic disorders. According to the Centers for Disease Control, many Americans have high-risk behaviors or modifiable risk factors. Most Americans don't exercise 3 times weekly, which is what the American Heart Association recommends. Almost half of adult Americans have high blood pressure, high cholesterol, or they smoke, which are major risk factors for heart disease and stroke. Most Americans' diets are high in cholesterol, high in fat, sugar, and salt, and low nutritional value. Highly processed foods have taken the place of fruits and vegetables. This brings me to my third point, which is people need to take responsibility for their own health and find a primary care provider. A primary health care provider can be a medical doctor, a nurse practitioner, or a physician assistant. And the reason for this is to help prevent chronic disease, according to the National Institute of Health in 2014. A primary care provider, or PCP, helps prevent the occurrence of chronic disease and helps educate patients. They help prevent emergency situations. An example of this would be a simple blood pressure check to prevent stroke. An ounce prevention equals a pound of cure. I have patients tell me all the time that I can't afford a primary care provider, but they smoke and they drink. Seeking affordable insurance, going to government subsidized clinics, or paying copays is much more affordable than an ER visit or an extended hospital stay. My fourth point is about health education. Seeking health information is the individual's responsibility. The internet, using reliable sources such as WebMD, Mayo Clinic, American Medical Association for Patients, and Medline Plus, are excellent sources of education. Free resources are the public library, health department, and community health fairs. And as stated previously, your PCP is a great source of education. This brings me to my conclusion. Our health is first and foremost our responsibility. Being in a healthy state of human life is valuable to God. God is our creator and therefore values his creations. In Psalms 24:1, the earth is the Lord's and everything in it, the world and all who live in it. We can bring glory to God by taking care of his creations. I encourage you to use your resources and your God-given talents to obtain the best possible healthful life.